In this video, we will be going over some vascular tests for thoracic outlet syndrome. First, you should take your patient's resting pulse rate before each test. This will be the radial pulse with their arm by their side recorded in beats per minute. As you can see here. The first test we will be going over is the Adson's maneuver. This tests the subclavian artery and can be completed with patient sitting or standing. The therapist will place the patient's arm into 30 degrees of abduction and maximal extension. The radial pulse will be palpated and the examiner grasps the patient's wrist. Quality of the radial pulse is evaluated in comparison to the pulse taken while the arm is being rested at the patient's side. The test is considered positive if there is a marked decrease or disappearance of the radial pulse. The sensitivity of this test is 0.79 and the specificity is 0.76. Next, we will be looking at Wright's test. This is thought to implicate the axillary interval. The patient can be sitting or standing. First, we will have the patient head forward while the arm is passively brought into abduction and external rotation to 90 degrees without tilting the head. The elbow will be flexed no more than 45 degrees, and the arm is then held for 1 minute. The radial pulse is measured and patient symptoms are monitored. The second part of this test is bringing the patient's arm into hyperabduction. The radial pulse will be measured and the patient symptoms will again be monitored. This test is positive if there is a decrease in the radial pulse and or reproduction of the patient's symptoms.